Well, we're here today at Performance Health, and we appreciate you coming in and telling us a little bit about what's going on. You'll give us a little idea of what's happened over the last year. I know you were in a car accident. If you would just, in your own words, tell us a little bit what's going on, and then we're going to do a little bit of examination, and we're trying to set up a program to get you better, which is the most important part. You have to get her better.
Awesome. I was in a car accident in July last year, and I've gone through everything in the past year from concussion to depression, anxiety, PTSD, headaches, vertigo, dizzy spells, loss of memory, loss of balance, weight issues, thyroid issues, everything that you can imagine from one car accident. And I've tried countless therapies to heal this. Some work and some make it worse. So I'm hoping that this treatment could help.
Okay, absolutely. Now you had it in the past, so we'll talk a little bit about that in a second. Just tell me, describe the accident to me. So where were you? How were you seated? Where'd you get hit? Did you know what was coming? Was your head turned? Some of those things.
I was driving straight, both hands on the wheel, coming to a stop at a red light, and a girl came flying out of a side street on my street and T-boned us in the passenger side.
On the passenger side?
Passenger side.
And you were the driver?
I was the driver.
Okay.
Yes.
So, did you see it with your head straight?
Head was straight.
Head was straight.
I did not see her.
So, when you get T-boned, this is usually not as good as like if you saw it in the rearview mirror, you had a chance to brace, and the other thing, you didn't have a chance to brace or anything like that. So when we get the T-bone, we get this lateral motion, which is C3, and this can cause a lot of ligament damage. And so we're going to look at that. And you had an MRI, correct?
Correct.
You've had x-rays?
Yes.
We're going to go back and do another MRI?
Yes.
Okay. And then, so what have we found out? We found that we have some nerve damage. Tell me a little bit about that.
Through EMG, they found nerve damage in my neck. I don't know the full details of where. But definitely that it's running down the back of my left arm.
The left arm.
Yes,
okay.
So my arms are numb most of the time.
Most of the time, okay.
Yes.
So that means we have something central, a little bit more on the left, but if I have it on both sides, that means there's some central things going on, as well as some peripheral things too as well. So you talked a lot about a lot of things happening metabolically, as well.
Yes.
And so it's been pretty well documented that when you get a whiplash trauma, when you get this motion, whether it's forward to back or side to side, this causes micro tears in the hypothalamus, which is the hypothalamus relates to the pituitary, which is all your hormones. So it's not unusual, it's been well documented that these problems start to happen. Your adrenals start to work overtime, which makes you anxious, makes it harder to sleep, and then you get depressed. So I don't know if you're experiencing any of those, but that's usually the normal scenario it's going. So we're dealing with not only this neuromuscular aspect, but we're also dealing with a lot of metabolic things going on too as well. So we just want you to know it's a closed system and they're all intertwined. Unfortunately, we know where it started. So that's the good thing, but the bad thing is that we have some work to do, because you have a concussion. Concussion causes what we call a glutamate cascade, which causes those neurons to fire more and more and more and more. And this is really hard, and we won't go too much into neurology on that particular part. Now, you also had some things too, as well as a few weeks ago, you came back in, had a flare-up, did some things, and now you have some vascular events where if you get a little bit of floater from laying down to seated, is that correct?
Correct. Just when I'm laying down, I have a black floater in my left eye.
In your left eye?
Correct.
Okay. And that's only been for how many weeks?
About 4 weeks, I think I first noticed.
About 4 weeks, so you had anything. Now, other things that we know from many different concussion syndromes and whiplashes is vision. You talked a little bit, tell us a little bit about how your vision is going.
I have blurred vision on and off, tunnel vision, and I feel like my eyes just kind of cross sometimes if I'm trying to focus too hard, or if I'm in bright lights.
Okay, so she's telling us and describing things that we know comes from an area of the brainstem called the vestibular apparatus, and that's your balance center. So your balance center is really important for, obviously balance is one of the big things, but this also works in line in the ascending pathways to your eyes and in the descending pathways to your neck and back muscles. So we have complete imbalance. So what she's telling me, I have a vestibular problem, I need help. The big things that fire into the vestibular apparatus are your upper 3 cervicals, which we know we have nerve damage. We're going to test you to put your canals, the ear canals, as well to see how that fires into it. And then the cerebellum, which we know it has some problems with the cerebellum too as well. So we have the trifecta. We're 3 for 3. So we have a little bit of work to do. You okay?
Yes.
All right. So let's take a moment here, and we're going to do a little bit of examination. Thanks.
Thank you.
All right.